Welcome, Dr. Gita, and all the people who are going to be watching us live today. Today, we are going to be discussing about our experiences on how we have been able to shape up our own practice and our own perceptions regarding our specialization, our work, and our dealing with the patients. And we are trying to keep it very concise and brief and cover 5 specific points which we wanted to highlight in a short period of 20 minutes. So welcome again, Dr. Gita, madam.
Thank you, Rajesh. Thank you so much.
So let's move on to the first part, the first tip. What we are wanting to highlight is here, what you should decide, whether you want to be a generalist or you would prefer to be a specialist. So this here, basically, we are talking about both the extremes. Like from my own perspective, I would like to say that I am a very focused specialist, a gynecologist focused on laparoscopic surgery, that too focused on benign laparoscopic surgery. And even in benign laparoscopic surgery, I am focused on simple procedures like hysterectomy, myomectomy, ovarian cyst, not delving into a few other aspects like suspension procedures. So it's very, very focused work which I am doing. As compared to that, I would also request Dr. Gita to explain a little bit about the same concept.
Right. So obstetrics, OBGYN, I think lends itself to being a generalist because you are having so many specialties in one. You're not just an obstetrician, you're also a gynecologist, you're a reproductive specialist. You do so many things, ultrasound, you can do fetal medicine. So being a generalist is how I started. My practice was across the entire spectrum because I was too passionate about all of it to give up any of it. But this rethinking of our practice can happen over several years. It can happen over decades. You can start off as a generalist, and we all know that obstetrics is the bread and butter of our practice. So if you start building up your obstetric practice, then your gynec comes on, and then you can add on anything else to it. But for people who want to start off as specialists, it may not be particularly easy unless you're trained in one particular specialty. So what I would suggest is you start as a generalist, and then find out what you're passionate about. Does PCOS make you feel that do you have people in your family who are suffering from PCOS? Do you want to make sure that you are the person that everybody will turn to? At that point, you can start building up a specialty, right? So whether you're a generalist or a specialist, you can rethink over a few years and then decide where you want to go. And also, the most important thing is decide whatever you decide, it's not about making money. Don't choose a specialty thinking, this is where I will make lots of money. I mean, we have to be sure, you have to be a little practical and say, yes, this will also help my career, will help my family, will help everything. But on the whole, if you follow your passion, and I have found that if you follow your passion, the money will follow you. It's not that you will be without it. So I think from our experiences, don't you think, Rajesh, that you have to follow your passion more than follow the trends of what everybody else is doing?
Yes, that is very true. Actually, for me, what happened is when I started my practice, I was really passionate about laparoscopic surgery, and I enjoyed the concept of being able to operate and with minimal trauma to the patient. So the thought which I had is, when I started my practice, that I would do only laparoscopic surgery because this is something which I'm thrilled about. I started the practice thinking that fine, I will try it for 1 year, and if at the end of 1 year I find that it is difficult to survive, then I would probably expand into everything else, do normal deliveries, do general consultation and other things. But touchwood, fortunately, the concept that I was sticking only to endoscopic surgery helped me to gain a certain amount of an identity in my area. So people would come to me because they would know that he does only surgery or he does only laparoscopic surgery. So somehow I felt that specific specialization or restriction to one particular field allowed me to be labeled as that person, which in turn brought in more patients. So it became a reverse situation. The flow was, in fact, better because I was specifically restricted to a particular aspect. My thought was, if there were 100 gynecologists in Akola when I started my practice, if I start as a routine OBGYN, I would be 101. Then from 101 to move on to the first 10 people or the top 10 slots would probably take another 10, 20 years. So my thought was that if I label myself as a gynec endoscopic surgeon doing only that and nothing else, it would start a separate line. So anybody else who started as an endoscopic surgery or a gynec endoscopic surgery would fall in line behind me. So that really worked. The concept of having a separate line where I was the first one to start doing it made a tremendous impact. And that also helps to a certain extent when you are at the right place at the right time and not too many other people are doing it. That I think
Right.
plays a key role.
Exactly. So to be a generalist, you also have to have some other things in your pocket, like an ultrasound or something else that you specifically also are good at. Yes.
Help. I mean, I there were times when people would come and say that, okay, why would you not always also do the infertility workup and probably also not deliver the patient? So that is one thing which always plays in the mind, that how do I turn back the patient saying that no, I don't do infertility treatment, I only do the surgical part. For treatment you have to go to somebody else. So the thought process would be that whether the patient would also go and get operated with somebody else because they would do the follow up treatment also. That does play a certain role, but ultimately what matters is also what you really enjoy doing. So from
You
that
know what I
perspective,
always say, that patients will remember you for the way you treat them, because kindness is something that can even a deaf man can hear and a blind man can see. So it doesn't, don't worry about somebody else stealing your patient or patients going away to somebody else. The way you treat them, they will come back to you. So
true.
shall we move on to tip number 2?
Yeah. So here we have to be talking about adapting yourself to your surrounding and your resources. What are your thoughts about this, madam?
So I came back. I had trained in the United States. I came back, and I came back to a well-known hospital, but it had, over the years, because Dr. Evie Kalyani had become much older. She was 75 when we came back, and it was certainly in no way as far as um, technology was concerned, it had nothing as compared to what I had come back from the US. But the thing is, you decide, this is where I'm going to practice, this is where I'm putting down my roots, and then you start changing your surroundings. We never went to super expensive corporate hospital kind of this thing, because I didn't want patients to walk away thinking, oh, we can't afford this. So we decided to use what resources we had and to give the same care that I would give to somebody in the United States, but without the spit and polish, as they say, without all the fancy, the chrome, the shiny things, right? But we can give in a very ordinary place, we can give excellent care. And that's what patients recognize. And so you will get patients from all walks of life, from the cream of the crop, the highest, the most elite in the city, to the people who can't quite afford it. They will come to you because you are willing to give excellent care based on your surroundings. What does your population around you, do they require and what can they afford? And that is extremely important. How did it happen with you in Akola?
Yeah, also from the same context, like from my own perspective, what happened is I enjoyed laparoscopic surgery, and in my head I was pre-decided that okay, this is what I'm going to be doing over a number of years. So the option when I started my practice was where to start. I was in Bombay for 11 years for my undergraduation, post graduation. There was a window of opportunity where I could have started working and settled in Bombay. Akola is my hometown where I could have come back and worked here. Hyderabad, my sister is anesthetist. They were keen that I should settle in a bigger city like Hyderabad. My thought process was that primarily because me and my wife both are from Akola, our parents are from Akola. So family decision is much more relevant compared to practice perspective. You can practice anywhere, practice will work anywhere, money will come in anywhere. So my thought was, if I am in Akola, fine. I would look at it as some place where nobody else is doing laparoscopy, an absolutely open field for me. I can work as much as I want, have my own hospital, my own advantages. Compared to that, I could have also settled in Bombay. Again, a different kind of an approach. If I was in Bombay, I would have looked at it from another aspect. A lot of freelancing I have done for a year. Options to operate, get patients are always available, whatever the circumstances, whatever the place, location you are. You have to be able to look around, see the opportunities, and pick them up. That is as simple as that. It does not matter whether you are in a government hospital, charitable hospital, private practice, corporate hospital. Window of opportunity can be created in any surrounding, any settings.
Right. And that's why we have to change our surroundings also. So when we came back, we expected a level of nursing that our nurses were not trained for. So Arjun and I used to do in-house training for our nurses, and they turned out to be one of the, I mean, they could have competed with anybody in the city. Okay. So it's a question of how you go about changing your surroundings. I'm sure you have changed your technicians in your theater, you have changed the nursing care in your hospital based on what was required, and you have to put in that effort. You can't say, oh, my nurses are not good, oh, my technicians are not good. No, you train them. It's up to you to change your surroundings.
More than the staff, it is the assistant which matters to an endoscopist. If the surgery is not going well, it's so easy to blame the person that you're not showing the camera properly. And that is a
Right.
standard response which comes out in the learning curve. But
Right.
ultimately, it does matter that you have to be able to adapt. And plus, I think that is really great for what you are mentioning, that you have to educate and train and make your staff and your nurses provide the exceptional quality of care that you would want yourself.
Exactly. Exactly.
Moving on to the third point which we wanted to talk today, that affordable care, but along with that, no compromise in the quality of care that we are providing to the patients. And that is what really goes a long way in establishing as a good reputed place or a good reputed doctor, I believe.
Right. So again, for affordable care, the thing is, I brought back a lot of devices. You're talking about laparoscopy. I learned laparoscopy in 1980, before I came back from the US, and it was just the very beginning. But I brought back laparoscopic, the whole equipment. Brought back an ultrasound. Brought back a fetal monitor. But the thing is, it's still, you cannot charge the patient because you're using this device. You never try to say, I'm going to use these machines or these technologies, and therefore the patient is going to have to pay more for it, right? You have to continue, you have to look at the long term. You have to say, if you use it on a lot of patients, ultimately the cost will come back. So you have to continue to be able to give affordable care. And for us was a very simple thing. We had a top level where we would not go beyond that cost, and anything below that, if a patient couldn't afford it, or they chose a cheaper room, or they said, I don't need AC, the cost came down depending on that. And then on top of everything, I think it behooves us to be able to give free care to a certain number of patients without questioning it. You have to do it. And I think that has been a tradition at our hospital. And I think that's something that all of us should remember, because that person will bring back 6 other patients who will pay and will, say, that doctor didn't charge me much. That is the most important thing. So it's got to be affordable care, but there is no compromise. Just because they're in a cheaper room, or just because they're paying less, they don't get one iota less as far as my involvement in their care is concerned.
Yes, another thing which I find here, which helped me in the beginning, was when even right from the time that I started in 2002, I always had this package concept, which was a printed option, which was handed over to the patient. Like today, we have 4 different kinds of packages ranging from first, second, third, and general. So a patient gets to decide whether he wants to go in for the highest first class package, or he wants to go in for a general class package. And if I am saying that, okay, it's the same surgery and you can decide what package you would like to select, very surprisingly, you find a lot of times the patient would come up and say that, no, we want to go in for the first class package. We don't mind the expenses. And at the same time, you have the opportunity to be able to operate at a lower cost. So the spectrum is good as long as transparency is maintained. I think that is something which has really helped right from the beginning for me also. People know that I do operate free of charge whenever there is a workshop or whenever we hold camps, even today in Akola. And
Correct.
if the patient is not affording, they can come in during that time, and actually the surgery is done for a meager amount or for basic cost of consumables. At the same time, patients come to Nanavati Hospital in Bombay, opt for a suite room, and they get a hysterectomy done for 6 lakh, 7 lakh rupees. It's a choice which they execute. I am not telling them that, no, you have to take this and you have to spend this much. So that is where I feel that sometimes as a doctor, I have been surprised quite often that patients have the capacity to pay. It's just that the freedom to choose has to be with the patient.
Well, we are also dealing with Indians, and if you say that a sari costs 2 lakhs, they'd rather buy that than a same sari at 2,000 rupees. Okay, just because we Indians like to say, "Oh, I spent so much for my hysterectomy or for this sari," but on the whole, as long as they're aware that your care is not going to be influenced by what they're paying, okay, as long as they have that trust, it doesn't matter. It doesn't matter what you charge. And we didn't bother about high charges, because as I said, you can do a lot of cases and make the same amount. And for your skills, you're getting paid for your skills. You're not saying that you have to come to me. So it's a question of what you charge is entirely your decision. Absolutely. Yeah.
Next thing which I think we wanted to discuss is, as a doctor, what is very relevant is to be able to keep up with the knowledge today. There are so many options available nowadays, and in so many various ways in which people can develop themselves in the course of their practice. Sometimes it becomes confusing to decide what is ideal, what is best. As a doctor, for my own growth, what is your recommendation for this?
There are two things. I think see, none of us know everything about everything. So in our hospital, we had a very simple thing. In front of in my consulting room, we had a bookshelf like this, and it was filled with a few specific things that we needed to refer to. What drugs are safe in pregnancy? Then what are the some complicated, especially in ultrasound, complicated syndromes and all that, or specific in oncology, because I used to do oncology also. So if there was something that I had to look up, there is no shame in looking it up. What I would tell them is, give me 5 minutes. I just want to think about this a little bit. Have them step out of the consulting room, go through this, check and make sure that I was not doing anything wrong. So right there, remember that we shouldn't start believing our own mythology that doctors know everything. Aap to devta hai. That's all nonsense, because we are not completely knowledgeable about every aspect of medicine. So we have to look up things, or we can call a colleague. The other thing is, choose guidelines. Guidelines will tell you, and this can be from ACOG or RCOG or the Canadian guidelines or Foxy guidelines. Choose and decide to follow that in your hospital, implement it, and everybody in your hospital should be implementing the same guideline. If you're going to a conference, don't get confused by everything that each person says. Somebody says, I use this medication, it's fantastic. Somebody says that medicine is hopeless. Don't get confused. Come back, look at the guidelines, because guidelines look at all the evidence, and then they say, this at this point in time is the best way to handle this situation. So I think guidelines is something that you should be able to access.
From my perspective, as far as surgery is concerned or laparoscopic surgery is concerned, it becomes a little easier, because for me to tell everyone that, no, you can go ahead and attend any live workshop, you'll always pick up something good out of it, becomes very
Yes.
easy. Surgery
Yes.
is a skill enhancement can happen at any level. But overall, if one is given a choice of maybe 10 different programs to attend, anything with live surgery always stands at a far significant advantage compared to edited lectures and programs, because
Understood.
sometimes the problems that you tend to face are not seen in those edited programs or lectures, while as a live surgery, if a problem arises, if a difficulty arises, you can see how people are handling it, and that is how you learn from other people's mistakes. That is the ideal way to grow as far as surgical skill is concerned.
Absolutely. Absolutely. I agree with that 100%.
We'll move on to the last point for today, which is very important from a doctor's perspective. And that is basically important about dealing with the pharma, because there are so many plus points, there are so many minus points, more minus than plus in these situations. Your viewpoints on this, madam?
So we had a very strict principle. As far as pharma is concerned, we don't believe that you can be manipulated by pharma, because the patient is completely at your mercy. Whatever you say is what they are going to take as far as drugs are concerned, devices are concerned, things are what they use. So we have to be the champions for our patients. We have to make sure that we are the buffer between the pharma companies and them. We have to make sure that we get them the cheapest drug, best quality drug, and not be manipulated by a pharmaceutical representative who promises you trips, who promises you conferences, who promises you all kinds of things. Use them for certain things, sponsoring educational conferences, yes, but not enough to convert you into their spokesperson. Okay, we have to maintain that integrity, and it's extremely important that we continue to be the heroes for our patients. Give them the best, but at the same time make sure that the pharma is not influencing you.
Just a small thing from my side in this, because see, I'm not having much of an outpatient work, or I don't see OPD patients, since I do only only surgeries. But even in that, the context what I have is whatever is required as medicine for the surgical part, whether it is IV fluid, or it is a gelco or a venflon, or a consumable to be used in surgery. I have a principle that everything is in-house, provided by the hospital during the
Yes,
surgery for the patient. We don't give any prescription to the patient. The patient is not expected to run around, the relative is not expected to run around getting stuff from outside or from even the
that's it.
shop within the premises.
Right.
Whatever is required, we use it, and it is part of the surgical package. There is no separate cost involved for any of these things. Becomes more easy to handle for me, because I get to use only those things which I prefer to use during surgery. Plus, there is no inflated cost which is handing over to the patient. Ultimately,
Correct.
it's my patient. The
Right.
end amount which the patient is going to spend, whether it is through a pharmacy or directly to me, is going to affect me, because that is the amount which he considers has been paid for the entire surgery. So I
Correct.
think that makes a difference, that you provide the cost benefit of the
Yes.
wholesale cost directly to the patient.
Absolutely, absolutely. In fact, when we had, especially in infertility drugs, when they used to offer us, they'd say, "We'll give it to you at a cost of, these infertility drugs are so expensive, HCG, HMG, and all that." They'd say, "We'll give it to you for 300 rupees, and you can sell it in your pharmacy for 800 rupees." And I'd say that's perfect, because I would give those 300 rupee vials directly at cost price to patients who couldn't afford it. Okay, so that gave me so I used that as a way of it was a win-win for the patient. We didn't charge them the MRP. We got it at a lower cost and passed it along to the patient. So I think we have to be, as I said, we have to work from our heart and protect our patients against these pharma giants. That's my principle.
Ultimately, everything comes down to the same thing, that you have to have your patient's preference or the
Yes.
patient as a priority for all your dealings, or all your ways the things are handled at your place.
Correct, correct. Yeah. So that's
From the perspective of doing a practice, whether it is about getting the patient investigated or whether it is about prescribing the drugs, I really think ultimately the patient is trusting you as a doctor, and that is where it creates a significant long term impact about the patients coming back to you, or putting their complete faith in you.
Right. And that's why there's a lot of violence against doctors, because there is enough knowledge out there that that doctors benefit from pharma writing certain pharmaceutical drugs, benefit from sending to a specific investigate lab or diagnostic center, and patients are aware of it, and it turns around and hurts you. So I think we can do very well without all those kind of added benefits.
Is very true. And I think we are just about to finish our session. I would again like to thank you for your time today. This is just an interaction which myself and Dr. Geeta we have on the screen, so that we are able to share our experiences with the audience who are into practice or who are in their learning curve, so that you get to learn from our experiences and get the benefit of not having to go through the struggles which most of the seniors would have already gone through.
Right,
Um,
exactly. So it obviously seems to be having a good impact, Rajesh, because I think that video of ours has had almost 11,000 views, and we are getting a lot of comments and feedback. And please keep writing to us, asking us what else you want, any other topics that we should address. We'd be more than happy to do that.
Thank you very much, madam, for sparing your time again. And with that, we would like to thank the audience also for listening to us.
Yeah,
Thank you.
it's always a pleasure, Rajesh. Bye.